Did you know that according to the World Health Organization, the WHO, acute lower respiratory infections, including those that can cause a wet cough, are responsible for nearly 3 million deaths worldwide every year, making it the leading cause of infectious disease-related deaths? Well, not to scare you, but in today's video, we're going to be talking about a topic that's a little less pleasant, yet one we all need to be aware of: what you can do about a wet cough. Whether you've experienced it yourself or have had a loved one deal with it, a wet cough can be a challenging and uncomfortable condition to manage. In this video, we'll be exploring what causes a wet cough, how it differs from a dry cough, the symptoms and complications associated with the condition, and natural treatment methods to help manage it. Make sure to stay till the end of the video, because we're going to show you shocking facts about wet coughs that you had absolutely no idea about. Welcome to Wellness Wonders. On this channel, we'll talk about getting healthy using both the conventional Western medicine and the more holistic and integrative approaches advocated by the Eastern medicine tenets. If this is something that appeals to you, be sure to stay around for more content like this. So sit back, relax, and let's dive into the world of wet coughs. What is meant by the term wet cough, and how exactly does it contrast with the more common dry cough? The presence of mucus or phlegm in the airways is one of the characteristics of a cough that is described as being wet. This sort of cough is also referred to as a productive cough due to the fact that it assists in the expulsion of mucus and the clearing of the airways. In contrast, a dry cough is referred to as a non-productive cough, which means it does not result in the production of any mucus or phlegm. Now let's talk about what goes on in your body when you have a wet cough. As you take a breath in, the air that enters your body makes its way down your trachea, also known as your windpipe, and into your lungs. When the air travels via a network of passageways known as bronchi, which ultimately culminate in the very small air sacs in your lungs, known as alveoli. The absorption of oxygen from the surrounding air into the circulation and the exhalation of carbon dioxide from the body both take place in these little air sacs, which is where the magic occurs. Nonetheless, there are instances in which things do not proceed as planned. When your airways are inflamed by viruses, bacteria, or other irritants, they produce additional mucus in an effort to trap the invaders and flush them out of the body. This extra mucus may cause congestion in the airways, which in turn can make it more difficult to breathe. And here's where the wet cough comes in. It's how your body eliminates that extra mucus and cleanses the airways. Now about the causes of a wet cough. One of life's great mysteries, isn't it? Well, maybe not so much of a mystery, but still important to know. So let's check some of them out. Bronchitis, which is an infection of the respiratory system, is one of the most typical causes of this problem. It's an inflammation of the bronchial tubes, which are the air passages that carry air to and from the lungs. When these tubes become irritated, they produce excess mucus, leading to a wet cough. Allergies are another possible source of the problem. When you have an allergy to anything, your body will generate an excessive amount of mucus in an effort to flush the allergen out of your system. This excess mucus can then cause a wet cough, which can be particularly annoying if you're also dealing with itchy eyes and a runny nose on top of that. If you are experiencing all three of these symptoms, see a doctor as soon as possible. If you smoke, you may also have an increased risk of developing a wet cough. The lining of your lungs becomes irritated when you smoke, which causes your lungs to generate much more mucus than they should. A chronic cough that sounds like you're gargling with swamp water might be the result of an overabundance of mucus in the respiratory tract. And then we have GERD, or gastroesophageal reflux disease, a condition in which the stomach acid backs up into the esophagus, causing irritation and inflammation. And you guessed it, this can also trigger a cough, especially at night. So not only are you dealing with acid reflux, but you also have a wet cough to top it all off. What a combo. So what exactly are the symptoms and complications of this condition? Are there warning signs or extreme cases, especially if it's treated quickly? Well, let's find out. The production of mucus or phlegm when coughing is one of the hallmarks of a wet cough, and it's also one of the most prevalent symptoms. This mucus may be viscous and pigmented, and it may also have an unpleasant odor. In addition to producing mucus, a person who has a wet cough may also have chest congestion, wheezing, and shortness of breath. The severity of the symptoms of wet cough can vary widely depending upon the underlying cause of the condition. Children with asthma are more likely to experience more significant symptoms, while in certain instances, a person may only suffer moderate symptoms that may not hinder their ability to carry out their typical activities. However, in more severe cases, the symptoms can be incapacitating and may interfere with a person's ability to work, exercise, or even sleep, which can make it difficult to diagnose and treat the condition. A wet cough, in addition to causing the symptoms, may also result in a variety of consequences. A lung infection, which may be brought on by bacteria or viruses, is one of the most typical complications of wet cough. This infection may progress to pneumonia, a more dangerous illness that can produce symptoms such as fever, chest discomfort, and trouble breathing. Hey guys, if you're enjoying this video so far, please hit that subscribe button for more content like this. It would really help our small channel grow, so we can make even more videos for you. Alright, coughs can be a lot, especially when they're not treated as they should be, but thankfully, you have us to help you with information on that. First off, there are both natural treatments and medical prescriptions to help you handle a wet cough. Let's check out the natural ones first. First on the list, we have honey. Yes, that sticky, sweet substance that bees work so hard to produce. Honey is a natural cough suppressant with antibacterial and antiviral properties that can help reduce inflammation and soothe the throat. Simply mix a tablespoon of honey into a cup of warm water or tea and drink it before bedtime. Next up, we have steam. Now, before you go running to your nearest sauna, hear me out. Inhaling steam can help loosen the mucus in your respiratory system and provide relief for a wet cough. You can achieve this by taking a hot shower or bath, or by holding your face over a bowl of hot water with a towel draped over your head to trap the steam. Just make sure to be careful not to burn yourself. We don't want you coughing from pain instead. If you're feeling a little salty about your cough, then try gargling with warm salt water. This can help soothe your throat and reduce inflammation. To prepare a saltwater gargle, mix a teaspoon of salt into a cup of warm water and gargle for 30 seconds before spitting out the water. It's not the most pleasant experience, but your throat will thank you for it later. Eucalyptus oil is also a great natural decongestant that can help relieve the symptoms of a wet cough. Add a few drops of eucalyptus oil to a bowl of hot water and inhale the steam. Or add a few drops to a carrier oil, such as coconut or olive oil, and massage onto your chest. Last but not least, we have turmeric milk. Turmeric is a natural anti-inflammatory and antioxidant herb that can help soothe the throat and reduce inflammation. To make turmeric milk, mix a teaspoon of turmeric powder with a cup of warm milk of your choice and drink it before bedtime. It may not be the most exciting drink out there, but it can definitely make a difference in how you feel. If natural remedies aren't doing the trick for you, there are also pharmaceutical treatments that can help alleviate the symptoms of a wet cough. One option is expectorants, which help to thin out and loosen mucus in the respiratory system, making it easier to cough up. These medications typically contain guaifenesin as the active ingredient and can be found over the counter in many drugstores. Another type of medication is cough suppressants, which work to reduce the urge to cough. These can be helpful in situations where a cough is interfering with sleep or other activities. Cough suppressants typically contain dextromethorphan or codeine and may be available over the counter or by prescription. In the event that your symptoms persist or worsen, it's always a good idea to consult a medical professional. On to the bonus section now, guys. First up, did you know that when you're suffering from a wet cough, your body can produce up to 2 teaspoons of mucus per hour? That's over 35 teaspoons of mucus in a single day. Yikes, that's a lot of mucus. But wait, it gets better, or worse, depending on how you look at it. You know that distinct sound a wet cough makes? Well, it turns out that sound is actually caused by the rapid movement of mucus and saliva in your respiratory system. So in a way, a wet cough is like a human beatbox. And hold on, we're not done yet. Did you know that the droplets released during a wet cough can travel at speeds up to 50 miles per hour? That's faster than most professional baseball pitches. I guess we could officially call wet coughs the new MVP of the respiratory system. All joking aside though, wet coughs can be a serious issue and should be taken seriously. It's important to stay hydrated, get plenty of rest, and seek medical attention if necessary. And maybe invest in some tissues and hand sanitizer while you're at it. And with that, that's a wrap. Thank you for staying till the end. We're sure you've learned a lot and laughed a little. Don't forget to leave a comment if you have suggestions or questions for us. We'd love to hear from you. Also, make sure to like and share this video with your friends. And if you haven't subscribed to this channel, please do so to get more amazing and helpful content. Until next time, bye.